Hello, and welcome to Chapter 17, the cardiovascular system. One of the biggest things about understanding the cardiovascular system is just understanding a lot of the terminology. When you kind of have a grasp on that terminology, that can help to make sense. So with the cardiovascular system, you can find procedures in 3 different sections of the CPT manual. So you have the radiology for diagnostic studies, the medicine for non-surgical and percutaneous, and then surgery for open and percutaneous. So it's very important that we pay close attention to what is being done here for our procedure. 2 things to know are the difference between invasive and non-invasive. So invasive means it enters the body. Opening the chest for removal of a tumor on the heart. Percutaneous placement of catheter in the arteries. So those invade, they break the skin. And both medicine and surgery contain invasive procedures. Non-invasive are procedures that do not break the skin, like an electrocardiogram, MRI. Any kind of test like that would be considered non-invasive. Electrophysiology is the study of the electrical system of the heart. So an example of the electrical system is like an irregular heartbeat. It's called an arrhythmia. So the study of that is a study in the electrical system. Nuclear cardiology is for diagnostic and treatment specialty. It uses radioactive substances for cardiac conditions. So like an MRI is an example of nuclear cardiology. The procedure codes in the cardiovascular system are divided into basically like 2 parts. So you have the heart and the pericardium, which starts with code 33016 and it goes to code 33999. That contains like pacemakers and valve disorders. And then pay attention because arteries and veins, which there are a lot, they start with code 34001 and go to 37799. So when you're reading your scenario, pay attention to where it's being done. Is it being done with a vein or an artery or the heart or the pericardium? So typically for veins and arteries, it's only for non-coronary vessels. So like anything that's not a vessel related to, or that's related to the heart. It's divided based on whether artery or vein was used. So you're going to look, an example is there are different codes for embolectomy depending on artery or vein. So if you kind of look through this section, you'll see that, it's all divided up based on whether there was an artery or a vein used. So pay close attention to that wording as well. Codes describe excision of acquired thrombus or congenital thrombus of an artery or vein. So pay attention to if it's acquired or congenital. A thrombus is an aggregation of blood factors and it causes vascular obstruction at the point of where it's formed. So wherever that's formed, it causes that obstruction. Some things to look for are non-selective and selective placement. So you'll hear when you're like placing a catheter or a needle, you want to know if it's non-selective or selective. So non-selective means it's a direct placement without further manipulation. And selective means you place and then manipulate it into further orders. So an example of non-selective, you could look up 36000 is introduction of needle into vein. Basically, the needle went into the vein, nothing else done. That's non-selective. Selective, 36012, that's placement of catheter into second order venous system. So the catheter went in, and they had to get it into the second order venous system. So it could not just be put in there in one vein. They had to kind of search for the second order, if that makes sense. So that is a selective. So let's code. I'm going to go over this with you. If you want to pause this video and kind of move slower than me, you can, or if you, however you want to do it. But our scenario is ligation of temporal artery. Okay, so the number one thing we're looking at is this is done to an artery. So we're going to go to that artery and that veins section. If you go to page 328, if you have a physical manual under arteries and veins, and it's page 768 in your digital, you will find ligation. And then we want to make sure we have the temporal artery. So this is an example of a specific artery was used. We want to make sure that we are including that in our codes. Let's code it again. This is a routine ECG with 12 leads with both professional and technical components. Okay, guys, this is kind of a curveball here. We're going to look in the medicine section because an ECG is not going to be, it's not going to be a procedure that's going to be in our cardiovascular system. It's not an open procedure. So you're going to look in the medicine section, you're going to look for cardiography, which is page 782 in the physical manual, page 1728 in the digital. And when you read the code, you'll see that 93000 is the correct code for this scenario. So that is one thing we have to pay attention to, is just the wording, making sure that we are in the right section, because sometimes they can throw you a curveball and it can be in the medicine or the radiology. And here's another one. Open transluminal balloon angioplasty aorta. We're going to look under veins and arteries. Okay, how do we know that? Well, number one, angioplasty, angi, lets us know that that is done to a vein or artery, and then aorta. So we're going to look under veins and arteries, which is page 323 in the physical manual, 760 in the digital manual. You're going to find angioplasty. You will see code 37246. We're only using one artery, doesn't state anything about any more, so we're only using that one code, and that's our code. I hope that this helps just clear up. I know that the cardiovascular system is overwhelming. There is a lot of information in there, but the biggest things I can tell you to remember are just understand that terminology, read your scenarios, make sure if it's done on the heart or the pericardium and arteries and veins, so that you're in the right section of finding those codes. Let us know if you have any questions.